Thank you for that introduction, Philip. As he said, my name is Valentina, and I will introduce myself a little bit more on upcoming slides. But our webinar today is really going to focus on using perception analyzer dials as a research tool, how these dials have been used in the past, how we've used them in recent studies, and maybe even talk a little bit about how these dials can be used in your research. And we'll get into that some more at the end. But this PowerPoint and presentation is really based around a study that we did last summer to understand college students' trust in COVID-19 related video messages. So I'm excited to take you guys through this kind of adventure that we went on. This was our first time using this tool to collect data here at the Pi Center, and it was definitely a learning experience. So I'm excited to share some of the tidbits and tricks and knowledge that we picked up along the way with you all today. Like Philip said, feel free to put any questions in the chat. We'll do our best to answer as we go on, but we'll have plenty of time at the end to answer any questions that went unanswered and just have a discussion. So Philip did a really good job introducing us today. For me personally, there's not much more to say. As he said, I'm a media coordinator for the Pi Center, or the IFAS Center for Public Issues Education in Ag and Natural Resources. But I also help on the Southeastern Coastal Center for Ag Health and Safety Outreach course. So I help with some outreach materials and some event planning, and of course, some research as we did here in the study. I'll turn it over to Dr. Baker for a quick second, see if there's anything else she wanted to add to that.
Philip also did a great job of introducing me, but I'll just add a few tidbits. My role typically with the Pi Center is as the lead researcher on many of our projects, and over the past 3 years, that has been pretty focused on COVID-19 and the impacts of COVID-19. So many of those were done in survey research, and this was kind of our first attempt at doing something a little bit different. And so, as Valentina said, and we'll tell you about it along the way, it being our first time, the learning curve was steep. And I think we learned a lot of things that these dials can do and things that they can't do, and ways to improve our understanding through some new methods. So we hope that you'll enjoy engaging in the conversation with us today related to how we did that.
Excellent. Thank you so much, Dr. Baker. So to get us started today, I'm just going to talk a little bit about what perception analyzer dials are, and just as a tool themselves, and a little bit about what they can do. So as you can see here on the screen, this is what the dial looks like. And at its basic core, it's an analysis tool that allows researchers to track second-by-second feedback as participants watch any kind of stimuli. And we would call this second-by-second tracking continuous response measurement. So the dials themselves are this tool that you see on the screen, and what they can do is continuous response measurement. So sometimes those terms are used interchangeably, but I just think it's important to note that perception analyzer dials are the tool, and continuous response measurement are what they do. So the way that it works is each participant would have their own dial in hand, in person, which can be considered a limitation to the study. It does need to be done in person, where participants can have their own dial. Here at the Pi Center, I believe we have 25 dials, so that does limit the amount of data that we can collect at once. We only have 25 dials, so we can only collect 25 data from 25 participants at a time. But these dials, while participants are being exposed to a stimuli, in our case, our study used videos, but this can be done with podcasts or pretty much anything else that you would want to track second-by-second data on. You would show that to the participants and have them turn their dial to whatever prompt you would like them to answer. So on my second bullet point here, I said that trust is a really common thing that is measured with these dials, and that's actually what we did in our study. So we had participants turn the dial to determine their level of trust in the content that they were watching, with 0 being extremely untrustworthy and 100 being extremely trustworthy, and 50 being that neutral point of neither trustworthy nor untrustworthy. And so this technology is really helpful because it allows you to see how perceptions change as the content is playing. So think about, traditionally, if you have participants watch a video and then answer a survey afterwards, you're definitely going to get some good perceptions there, but it's going to be a little harder to determine what the specific moments in that content, what the specific moments were that caused their perceptions to change. So this tool is just really helpful in that it allows researchers to kind of go back in the data and see what were those specific moments, what was being said, what was being shown that maybe altered their perceptions in that moment. And I think that that provides a lot of really rich data that can be really helpful with things like message testing and those types of things. So on the next slide, I'm going to show what the output would look like. So here's an example of a participant using a dial in our lab. As you can see, this screen is actually off right now, but they would be watching whatever stimulus it is on the screen and turning their dials to show their perceptions as they watch it. And then on the bottom right here, this is just an example of what that data would look like once it's exported from the software. So in this little picture here, you can see the prompt at the top left was "I trust this message," and they would turn it towards the right to 100 to show if they strongly agreed, or to the left to show if they strongly disagreed. So on this slide, you can see here that just after the 1 minute mark, it looks like trust kind of piped up, right? So we would call that a peak, and we would call the low points a trough. So if I'm a researcher, this was not from our study, this is from a previous study in 2018 that used this technology, that would tell me that I need to go back to that moment in the video to see what was said or what was shown that caused trust to go up. On the other hand, we can see right at the 2 minute mark that we kind of got a trough right there. So a lot of participants turned their dials to the left to show that they did not trust that message. That would be really helpful for me as well, as a researcher who's analyzing this data. One thing to keep in mind with this tool is that there is a little bit of a delay in when participants see the content on the screen and when they think about what their reaction may be or their level of trust, and then they turn their dial accordingly, right? So someone who's analyzing this data or looking at this graph would probably want to see that moment where the peak or the trough is, and then go back a second or two to see what was said a couple seconds before, because that was probably what the participant saw. Then there's like a 2-second delay, and then they turn their dial, right? So you do have to kind of play with the data a little bit and go back and make sure that you're looking at the right things. So that's just something to keep in mind. I mean, you're still getting that really rich second by second data, but like I said, there's that about 2-second lag in when they turn their dial when they view the content. So that's just something to keep in mind, but here's an example of what that can look like. The last thing I want to point out on this little screen grab here of the data is on the left-hand side, you see two horizontal bars, one at the 90 mark and one at the 80 mark. So that's going to show you a little bit more detailed information regarding what dials are at what level, right? So I don't know, as we're watching this, what second in the video that would be, but this would tell me that, if I'm watching this and this is at the 1 minute mark, we have one dial or a few dials at the 90 mark and a few at the 80 and none in the 70, 60, 50, or 40. So whatever moment that is, it looks like it is pretty trustworthy from the participant's point of view. So it's just a couple different ways that you can look at the data. And one more thing that I want to point out is that this is what the graph output looks like on the software, but the data can actually be pulled out into, I believe, an Excel sheet, which can be transported into SPSS with the actual numerical data point for each second for each participant. So that is a lot of data. If you have 25 participants and you have them watch a 10-minute video, that each participant has 1 second of data for all 10 minutes, and you have 25 participants. So that is a lot of data, but you can run some additional statistical analysis on that if you so wish to, and I believe Dr. Baker will get into that a little more later on. So now I'm going to talk a little bit more about what we did last summer and how we used these dials. So as I mentioned earlier, we were looking to see college students' levels of trust in different COVID-19 related content or video messages. Excuse me. So the purpose of our study was to investigate college students' trust in COVID-19 vaccine-related content. And we had 3 objectives, but in this presentation, I'm really just going to focus on the first one, which was to determine messages that students found the most trustworthy. And the reason I'm doing that is because that is where we pulled that moment-to-moment technology from. And that data, we looked at those graphs to determine where the peaks and the troughs were. And that is something that's really unique to this tool. So that's what we're going to be focusing on today. The objectives 2 and 3 were more statistical analysis from data that we pulled from the technology, which we can absolutely talk some more about if anyone has any questions about that and is interested. But for the purposes of this presentation, we really want to focus on that graphical output since it is so unique to this technology. And just to talk a little bit more about the background of this research, around the time that we collected data, the COVID-19 vaccine was becoming more readily available, but research showed that young adults between the ages of 18 and 25 still had the lowest vaccine adoption rate among all US adults. So for our study, we wanted to see kind of where their trust was in different COVID-19 vaccine related content and see kind of how that may have affected their willingness to receive the vaccine, or their trust overall. So just threw this in here so that you guys could see kind of where we were at the time that we collected data for this study. So we collected data excuse me, from graduate and undergraduate college students at the University of Florida. Again, a limitation of this study, as I said before, is that to use the dials in person, everyone has to be in person. So we collected data in the month of July 2021, which was the first week of summer B. And at this time, I believe the first week of summer B was the first week that the university was really pushing for classes to be in person again. So we had been fully remote right up until that moment. So collecting participants on campus was definitely difficult. Campus was not very full. And I think people had gotten really used to doing things online up to that point. So getting people to actually come to the lab where we were collecting data was a little difficult. But all in all, we got 54 college students who are 18 and older who did participate in this research. And I want to point out something really quickly while I'm on the slide. I've said a few times that this has to be in person to collect data, which is true. The dials obviously have to be used in person. However, Dialsmith, which is the company that produces these dials, does offer an online version of this tool. So it's like a slider that you would use on your computer screen instead of a physical dial. But that would be, I believe it's a completely separate subscription. So if you had these dials and you wanted to collect data online, that would be an additional charge to do so. So right now we're just focusing on the in-person aspect of it. So going back to our study, the way we kind of did things is we welcomed participants into the lab. We did have them take a Qualtrics survey as they got there to collect some demographic information, COVID-19 knowledge and concerns, and social media use. Then we showed them a series of 7 videos from a variety of sources. The videos included local and national celebrities, and I'll show some examples on the next slide. But the point is that just to show that we did show a variety of different videos with different speakers to see how trust was influenced. Because we did show 7 videos, we actually included, I believe it was a 5-second break between each video where we asked participants to set their dials back to 50, which is the neutral point. So all participants would start with their dials at 50. We would give them the prompt. We asked them to turn their dial according to their level of trust in the content that they were watching. And to make sure that we were all kind of on the same page about what we meant by trust, we did give some examples and some definitions of trust. So of course, that can mean different things to everybody. So we wanted to just kind of reduce that variable and make sure we were all on the same page about that. So we read through a moderator's guide. We explained to participants how the study was going to work. We did show a practice video to give participants a chance to turn their dials and practice using the dial, since this is a little bit of a new technology that a lot of people may have not had the chance to use before. And then we instructed that participants to set their dials back to 50 as we started the first video, and again gave those cues and those prompts in between every video during that 5-second gap to set their dials back to 50 before the next video begins. And then at the end, once all videos were over, we did do one more Qualtrics survey, including asking questions related to source credibility and if their opinion of the COVID-19 vaccine was impacted at all by the content that they watched. So here are just some really quick screen grabs of some videos that we showed during our data collection. So as I said, we had some national celebrities here. We have Barack Obama on the bottom left. We had some local celebrities. The president of our university, Kent Fox, was included in a video. We also had videos that included student testimonials. So on the bottom right, these I believe were different student athletes talking about why it was important to receive the vaccine and how it meant that we could all come back to campus safely and kind of get back to normal. On the top right, I believe this was a television ad by the CDC and the Ad Council, which included other celebrities as well. And then we included a social media video as well. I believe that was from the Washington Post with Dave Jorgensen was the journalist that was included on there. So that was more of a social media type video. So we really wanted to see how trust changed across different speakers and different platforms and different video styles, really. And I believe the video with Barack Obama was also a social media video. So it was interesting to see how trust varied between each platform and each source. One thing that I did want to mention while we were here is that, of course, with some of these being television ads and some being social media videos, the length of the videos vary quite a bit. And I don't know, Dr. Baker can maybe correct me if she knows more about this than I do, but I don't know that there's too much of a limit for how long the videos need to be. So what I mean by that is you definitely want them to be a certain length, but I don't know what the limit is for them being too long. Of course, you worry about losing their participants' attention if the video's been going on too long. But I do know that this technology is often used in political science research and message testing in that way. I know that they have used it during like State of the Union addresses, which are quite long. So your videos can definitely get long. There's room for them to be quite long. But something that we ran into in our study was that one of our videos, I believe it was the one on the top left of the president of our university, was only about 6 seconds long. And we just found that to be way too short because as participants had just made up their mind of how they felt about the first few seconds of the video, that video was then over. So that's just something to keep in mind if you ever wanted to use this tool in your research. Definitely wanting to make sure that the videos are not too short. And then, of course, we need to look at to see how long they can get before we start to lose participants' attention too. But making sure they're not too short was the biggest thing that we ran into in our study. So now I'm going to hand it over to Dr. Baker to talk about some of our findings and results and how this tool as a research tool can be used with your research and how you might want to use it as well. So thank you so much, Dr. Baker. I'll hand it over to you.
Thank you, Valentina. I think Valentina did a wonderful job of describing all of the aspects of this so that I can now talk about some of the fun things that we found and how we can use this. I will say one of the things that is a theme throughout this, and Valentina alluded to this a little bit, is you just get so much data. And so it's almost overwhelming the amount of things that you could look at and the different angles and the different options when you think about collecting second by second data from participants. So what we essentially did and what we'd read in literature that other people had done before was we did compress the second by second data into 5-second increments, which reduced our data a little bit. It also gave us more compressed moments because people weren't really making changes on a second by second basis. They were taking a little bit of time to process that information. There also is a little bit of a delay. Someone may see something, they think about it, and then they turn their dial. So some of that we had to do some display of the data, like you see in this example here, for us to really look at where are the moments where people are making changes and adjustments along the way. So if you'll see that green line that runs across the middle, that's the mean or the average of the data for all 54 participants. And then that red line is the highest participant at that moment, and the blue line is the lowest participant response at that moment. So you can see there was a lot of variability between types of participants. So that's also one of those things that Valentina alluded to was difficult for us to get more than 50 people. So that meant we weren't able to compare between our participants very well. So we weren't able to say, well, male participants felt this and female participants felt this, or Republicans felt this way and Democrats felt this way, because we just didn't have enough people to divide it. So that might have given you some more details, but I think we were pleasantly surprised that when we plotted the data, there were some real trends that were happening here. I think as we were doing it, it felt kind of messy. We were unsure if we were getting what we wanted, but you'll notice the circles there are the places that we said were visually observed peaks. We also tested that statistically to make sure they were statistically different from the mean. So you'll see on our slide there, we have it running from about 73.46 on that 100-point scale to 57.64. So while visually they may not look as striking as the red peaks where individual decisions were made, they did rise to a level that was significantly above a mean response. And so there was also some commonalities between those, which we found exciting in the process. Is, many of these were the responses of the vaccine will allow us to get back to normal. I'll be able to return to my daily activities. Those types of getting back to normal, what the vaccine will allow me to do, were the ones that were consistently higher than some of the other messages that were delivered. So again, those patterns were fun for us to see after we'd done what felt like a really long summer of work trying to get to this process. So on the next slide, I think we'll start to highlight a little more of these findings. So the messages that the students found the most trustworthy, and again, that was our question. We kept reminding them of that question throughout the process. The idea that vaccines would end the pandemic, the future of the university. Now, those were the videos that Valentina highlighted that were from either, I guess, university celebrities, the president of the university. There were some sports stars, but there were also some regular student athletes in that process. But there's a quote there: "This is a huge step in keeping our community safe and making the university able to function as we know it can and will in the future." So those were the types of messages that really resonated. The next one, they're being a part of the solution to end the pandemic. Again, those positive messages seemed to work well with this audience. This one is actually from a national celebrity. "In order to get rid of this pandemic, it's important for our fellow citizens to get vaccinated." This idea of being safe was also a part of that. You'll see this quote there from Barack Obama: "The vaccine is safe, it is effective, and it is free." And that last one, that concept of getting back to normal, a local celebrity said this one: "Hopefully the vaccine will help everything get back to normal." So again, a lot of commonalities in those messages that students were finding more impactful, and we indicated in our data were the peaks. We also wanted to look at some of the differences. Again, we weren't able to isolate on participant differences because of our sample size, but we were able to isolate on differences within the videos themselves, because everyone did see all of the videos, to make sure there was no issue with video order. Each group saw them in an entirely different order. So that way there wasn't any order effect necessarily, but we were able to look at the difference between local speakers and national speakers, which, during a time when a lot of campuses were trying to decide, what do we do to get our student populations vaccinated? Because those numbers were low, as Valentina indicated, as students were coming back to campus. And, this difference between local and national speakers was something that was interesting for us to look at. We didn't see a lot of differences, certainly not significant differences between local and national speakers, but we did see significant differences between those local celebrity speakers and the local college students. And so, as people are trying to find speakers that are close to them, that they are able to use, choosing some of those local celebrities could have been an effective way to reach students within this study, anyway, who were interested in those aspects and found those people recognizable. So why is this important? Why did we do all of these things? Well, it did help us isolate messages in a different way. As I mentioned, we had done quite a few surveys, and we were able to ask some questions related to messages that might resonate, related to who people might trust, but we weren't able to really test that in an actual environment. And so one of the goals of using the dials is to get as close to a real environment as you can, which, they obviously weren't actually seeing these on social media, but they were able to operate their responses in an individual nature in that way. And we were able to see, not just in its entirety, did this video of Barack Obama affect your decisions? What did you trust about it? We were able to look in a moment-to-moment way. And again, as you looked at our data, I think that's one of the things that was the most exciting, is that in many cases, the differences between the speakers was not that great. We also looked at international versus domestic audiences, and we looked at platform differences and those things. And those things seem to matter less than the messages themselves, which again, that was much easier for us to test in a moment-to-moment way when we saw in real time what they were responding to. We are able in this way to analyze this data quantitatively. So we had statistics to compare to and to look at. But I'll talk about it in a minute. Some of this is kind of comparing the qualitative with the quantitative that we think as we move forward might be more effective to get kind of a clear picture of everything that's happening. Because while we were able to say these were more trustworthy than these messages, we weren't able from a numbers aspect to say why. What was it that really made a difference in trust in this moment versus this moment? Again, the messages being similar helped us understand that, but we felt like there was still some more left on the table as far as what we could really understand about why people were responding the way that they were. So what we think we've landed on is maybe more of an ideal scenario. Partially because, as we said, getting physical people in seats is the more difficult aspect of this. So the study we're talking about right now, we did not this summer we just finished. We collected the summer prior. We also collected some data this past summer on a different topic, but it allowed us to learn and grow from what we did before. So over this past summer, we were able to create the videos ourselves. So we were able to control some of those elements, whereas in the past one, we had to rely on what other people had done and align some differences that we were interested in seeing from people's previous work. But people could have already seen those videos. They could have already formed an opinion of those videos. We also weren't able to purposely embed a message in one type of scenario and then embed the same message in a different type of scenario. So we had a lot more control when we created the videos ourselves. That also is perhaps a more real world environment where we would be creating our own content and sharing it and wanting to measure that content to see what works and what doesn't work in a moment-to-moment way. But what we did this past summer and what we would recommend for people considering this is a combination of this. And this is also what Dial Smith, the company who sold us the dials, really recommends in these scenarios, is we were able to show people the videos that we created, varying order, all of those kinds of things. But immediately following, we were able to show them some of their data in real time. And we're able to say, all right, well, let's take a look at what our peaks and our troughs were. And for us, we were, kind of flattered that since we created these videos, Valentina was a big part in creating them. There weren't any troughs. People didn't have negative things to say. Our question in that was actually around credibility, but they did find the videos credible, and there were some peaks. And so what we were able to do is show them the graph and say, all right, look, here's a moment that happened in this video where there's a peak. Tell us what you were thinking. Like, why was this portion more credible than another portion? And we got some really good responses from that. I remember one participant saying, well, I don't, want to offend you or anything, but I think that in that moment, that shot really looks like stock footage. That doesn't feel real to me. And so that's why maybe I docked it for credibility. And then we were also able to see, well, what about the rest of you? Do you kind of feel the same? And they're like, I think that's what I was thinking too. And then there were also some moments where, again, we didn't necessarily have troughs, but maybe we had a few dips, and we could talk about those and ask, what's happening here? And we had different responses from different people. Some of them might have said, well, at that moment, the logos came up, I recognized one of them, found it really trustworthy. And another person might have said, well, in that moment, I saw a .com website instead of a .gov or a .edu website. And so for me, that kind of lowered the credibility in that moment. And so we're also just able to have conversations with people about, what was it in this moment that swayed you on the credibility, or it could be trust, or it could be any other question that you're asking, so that you can address some of those issues. And so as a result of what we did this summer, because we created those videos, we will have the opportunity to now make them better and improve our science communication as a part of that process, knowing the whys behind it. We also, in one of the videos was a kinetic typography or moving text video, and it didn't have voices, it didn't have photos, but it had an underlying track of music that we thought was, fairly quiet, fairly generic, not too distracting. But we did have one participant who had a disability, particularly related to sounds. And the sound that was underlying in that video was difficult for her to listen to. And in fact, as a part of this process, we regularly have people around the room, documenting the things that are happening. And one of our observers in that group said, I saw her cover her ears and look down, that she literally couldn't watch this video. And because no one on our team has that particular disability, even though we'd watched it quite a few times, that wasn't something we'd considered. So now moving forward, I think we will look more at, what types of music we use, whether those may seem completely innocuous to us. It may be something that completely turns another person off, or maybe they have a physical limitation where they literally can't listen to your content. And obviously we can't be effective science communicators if we're producing something that our audience can't physically even watch or participate in. So I think we learned so much in this kind of new combo format that perhaps we missed out on in the purely quantitative format. Not to say that we didn't learn things in that format, we certainly did, but we would say we're kind of recommending this more intertwined approach of, we get the what of they liked this, or they found this credible or believable, they didn't find this credible, but now we also have the why of that aspect. So I think the next step here is you hopefully thinking about how you can use perception analyzers, how they might be a part of your science communication plan, and figuring out what's working and what's not working. We can avoid information fatigue by not sharing messages that are not effective. We can also pinpoint elements of messages that result in that positive or negative response, because it might not be across the board that they like this person or they don't like this person. There may be moments in what they're saying that they respond to or don't respond to. We can also determine some of the most effective messaging frames, and using alongside some of these other research methods. We didn't talk much today about the things we had in the pre and the post test, but those do allow us to kind of isolate some of those data points and see if there are some of those demographics that make a difference as well. So I think with that, we do want to offer a few things to consider. Sorry, a little catch in my throat as everyone's returning back to school. It can be expensive, which I'm sure many of you are thinking. The cost to purchase the equipment and conduct the research yourself, the packages start at about $14,000 for 5 dials. There's additional costs for more dials, for training, for continued support. I will say, Valentina literally shared with me a few weeks ago that I might have the toxic positivity trait. And she's not wrong. I tend to think things are going to take less time, be less difficult, and be a part of a positive outcome than happens in reality. So even going into it with that frame, this took a lot of time. It took a lot of people's time. It wasn't just one person's time. So I think we're improving on the learning curve, but the equipment cost is there, and the time cost is also extremely high on the front end as well as the back end, compressing the data, understanding the data, and those kinds of things. So things to consider along that same line is that you will need staff to design and conduct the message testing, equipment and space that's easily accessible for your audience. And you probably will need participants in recruitment incentives to get people there. And again, that time and trained staff to analyze the data. So it's not all positive, but we can get positive information. We may have some opportunities to partner with stakeholder groups, particularly if there's a way we can write things into grants, because it is something we're interested in doing more. There are also consulting services directly with Dialsmith, who we purchase the dials from. And those packages range widely, depending on what you're wanting to do and how involved you want to be. But Eric here has been phenomenal. He's happy to answer questions, and he knows we might be sending people that way. If you're more interested in partnering with us in some way to do this work, my contact information is there. I'd be happy to follow up with you and talk about how we might be able to make a partnership work. And that's mostly what we have today. We'd be happy to answer questions that you may have as you're thinking about this work.
Yeah, well, thank you so much, Dr. Baker and Valentina. As Dr. Baker just said, yeah, we have some time for questions, for comments, for any ideas you might have, just whatever you want to talk about at this time. We have some time in our Q&A session, so you can use the chat box, you can use the Q&A, and we'll give everyone just a few moments to kind of get your ideas together and put some of those in. So there are a couple questions that our panelists can see, but I'll go ahead and read it out so everyone can hear it, and then I'll let them take the question. Great presentation, thank you. I have a couple questions. What time frame was used to calculate the means that were used to compare against the peaks? Did you consider the online dial option from Dialsmith?
So those are really good questions. I'll take the first question, and then I will probably punt the second question to Valentina. So the question related to what time frame we were used to calculate the means, we didn't necessarily do it by time, except that we compressed it into 5-second increments instead of 1-second increments. But then what we compared those peaks to, and we would have compared the troughs if we had any in that scenario, was the mean of 50. So the response scale ran from 0 to 100. And so we checked for statistical significance above that 50 mark or below that 50 mark. But people that are using this in a not necessarily academic way are often just looking at the peaks and the troughs and not necessarily comparing the numbers. But we tend to want the numbers. And before we purchased the dials, we did not know the online option existed. So we had not considered that in the moment that we did this study we talked about today. However, the Ag Safety Center has started some of that work. So I'll let Valentina talk about what that option can look like.
Yeah, absolutely. So that's exactly what I was going to say, Dr. Baker. We didn't consider it for the study because we didn't know that it existed. And it would have been helpful to know, but unfortunately, we just weren't there yet. I believe I said earlier, this was actually our first time using this technology ever after we had purchased the dial. So this was a huge learning experience for us. So it is absolutely correct. We are looking at using the online dial option from Dialsmith at an upcoming meeting with the Ag Safety Center that is happening in just a couple of weeks. So that will be done on a commercial for a online video series related to mental health and agriculture. So the series actually has two commercials, one that is narrated and one that is not. And I believe the one that is narrated has a lot more visual B-roll. So there's a couple variables for us to look at there. So we will be doing that online because we will be conducting the study over an online meeting. And like I said earlier, we have the dials from Dialsmith and we have this ongoing partnership with them, but the online component is something additional. So there is an extra charge for that because it does actually require some more support from Dialsmith. With the dials that we have here at the Pi Center, if we needed to go collect data tomorrow, we could take our dials and go collect data tomorrow independently on our own. But I believe with the online option, because it is hosted on the Dialsmith website, you do need to get in touch with them and send all your information over to them and actually have them upload that data for you and the questions for you. And I believe there will be someone on the day of working with us to make sure everything's running more smoothly. So because it does take a little bit more support from their end to run this study online, there is that additional charge. But of course, it also does open up so many more possibilities for collecting responses. So that's something that we're doing right now. And I'm excited to report back once we go through that process and kind of see what the pros and cons of that were. But yes, thank you, David. That was a really good question.
And thank you, Maggie, for the comment. Time consuming and costly, but I think offers a lot of potential, especially for fine-tuning long-term campaigns. So thank you for that.
Yeah, that's a good question, David. So it says to explain a little bit more about how the instructions and activities were conducted before sharing the videos, how the viewers and dials may have been calibrated. Was one participant 63 equivalent to another participant 63? Yeah, so that's a really good question, and that's definitely something we run into quite a bit when we're doing any kind of data collection with these dials, because there's really no way for us to know that one participant 63 was another participant 63. So what we did once we welcomed people into the lab, we gave them our definition of trust based in some literature, and then we gave them some examples of what trust would look like. So I believe, thinking off the top of my head here, but I believe the prompt that we gave them was, if someone told you something that you trusted completely and you felt no need to fact check this information because you trust it 100%, that would be 100. And if someone told you something that you thought is so untrue, you're not even going to bother fact checking it because you just know that it's wrong and you're not going to waste your time, that would be a 0, right? So then kind of in between, there's that variability, and maybe I kind of trust this and I'm going to maybe fact check one source, or I'm going to fact check 100 sources. So there really is a lot of variability. And like I said, there's no way for us to know exactly that they were all turning their dials to the right things at the right time. But we did find that giving that example at the beginning was really helpful in kind of getting us all on the same page of what we meant. So another thing that we did have to keep in mind quite a bit throughout is that, you can ask participants to turn their dial based on their level of trust 100 times. But sometimes people are just going to turn the dial to whether they like the video or not, whether they like the content that they're watching or not. So that is something that you can include in your moderator's guide like we did. And we actually repeated that in between every video. During that 5-second pause, we reiterated that we were measuring trust and we wanted them to turn their dial based on their level of trust in the content that they were watching. So we did repeat that quite a bit. And so we did the best that we could to kind of keep everyone on the same page, but of course, there's no way to know that for sure. So in future studies, we're kind of looking at seeing what things that we could ask where we maybe don't have to prompt people quite as much. Because in some of the focus groups in our most recent data collection that Dr. Baker mentioned earlier from this past summer, one feedback that we got a lot during focus groups was, oh my gosh, you guys repeated the prompt so many times. I thought you were about to trick me. I thought something crazy was going to happen on the screen and I was going to get caught off guard. So it was almost like we were stressing people out by how often we were saying this. So on one hand, you want to make sure you say it enough because you want everybody to be turning their dials for the right reasons and calibrate them in that way. But of course, then on the other hand, we don't want to stress our participants out. So we're kind of still working on that and seeing what that'll look like in the future. But that's kind of how we've done it so far to this point.
And there are a few things on the back end you can do to normalize the data. Where we reported means, we were able to run z-scores to standardize. Some researchers would eliminate complete outliers if there was, a reason for that, or if you looked back and saw, maybe they didn't exactly fit your population, to make sure you're getting at what you want to get at. We did also do a practice video, which may or may not have helped for them to get that experience and talk about that. But I would say Valentina's right. The common thing was, I'm not sure I'm remembering to evaluate trust or credibility, even though that was directly what we were telling them to do. So anytime you're studying humans, right, there's an element of messy and we're not sure. But I suspect that's also how they're responding to all of your science communication, is from whatever lens they're looking at it and their background and their experiences.
And I do see that other comment from Margaret, that we have seen these tools used to evaluate participants' comfort level with videos presented, especially graphic videos. So yes, that's something we've seen as well. We've seen these styles used in studies related to animal slaughter and participants' perceptions of slaughter videos, which of course are extremely graphic. Excuse me. So Dr. Baker early on mentioned that oftentimes we'll have people who are just in charge of observing during these sessions who take notes. And I believe in that particular study, one note that was taken was that someone actually got up and left halfway through the study section because it was too graphic. So that, the dials are very helpful in collecting that data. And I think they were really helpful in that study, but also just having people in the room who are taking notes on what is actually happening, and using that data together can be really, really helpful. So yeah, thank you for that comment.